On this episode of Athletic Training Chat, one of our hosts, Austin Fitzpatrick, leads a roundtable discussing baseball and just everything around athletic training and the sport. Austin has been working to get into the upper levels of baseball, hopefully into the pro ranks at some point, has had some experience around baseball due to COVID. It's been an interesting ride for him, but definitely something that he is really interested in. So here he is talking to athletic trainers from across the country at different levels of working with the sport about everything baseball. So please enjoy. Without going too much further, please remember we are powered by Mueller Sports Medicine. Check them out if you've got ideas. Shoot them an email, find that on their website, and we'll provide it for you as well. They're always looking for stuff. They're looking for feedback. They want to make athletic trainers' lives easier and provide products that are going to be impactful and useful to us. So with that, enjoy this episode.
Welcome to this episode of Athletic Training Chat. It's Austin here, and we have kind of a special one for you. It's been a while since we've done a roundtable, and this roundtable is especially meaningful to me because I live and breathe all things baseball, and we're lucky to bring athletic trainers from a variety of different settings. We have a bunch of collegiate athletic trainers, professional athletic trainers, so really, this episode is just dedicated to talking a lot about working in baseball and not only in baseball, but what baseball can, as athletic trainers, what we can bring to the profession as a whole. So without further ado, I'll kind of open it up here, and I'm going to have everyone go around the room here and introduce himself. And first up on my screen is Nick Adams. So Nick, you kind of want to introduce yourself for me?
So I'm Nick. Right now I'm up in Boston at Suffolk University. Kind of got a mishmash of sports, baseball in the spring. It's my third year doing that. Like I said, D3 right now. I've previously been D1 sports, Army, D2, so kind of had a little bit of everything. But this is my third year at Suffolk baseball, and yeah.
Awesome. All right, next I have Scott.
Yeah, Scott Stansberry, been here at Notre Dame since 2007 with baseball primarily. I also help with football in the fall, and then actually been an athletic trainer since 2003. And have a little experience in the collegiate baseball as a grad assistant. And then my first kind of full-time job, I was at Villanova prior to that. So kind of a big expanse of a D1 baseball primarily, but the experience of football helps a little bit too.
Awesome. Steven?
Yeah, Steven Rozier here, currently at Central Michigan University. I've been there for 2 months. So just getting my foot in the door to D1 baseball. I spent the last 3+ years at Lenoir-Rhyne University, a Division II in North Carolina, where I worked with football and baseball. So this is 4th year working baseball. Primarily spent most of my career at the Division II level at a few other schools and my graduate assistantship as well.
Awesome. And Obi?
Hey, Obi Benavidez. I am currently at Lamar University in Beaumont, Texas. I've been practicing for 6 years. This is only year, I guess, 1.5 with baseball. Prior to getting to Lamar, I was a football athletic trainer at a smaller private D1 in Texas. So relatively new to baseball.
Awesome. And Allison?
I'm Allison Hocking. I just finished up my second year with independent professional baseball. Before this, I was doing D2 baseball. And then in my off season, I do indoor professional soccer, but mainly just independent baseball.
Awesome. All right. So now that everyone's kind of introduced myself, a little about me too. My name is Austin. I'm also a Division I baseball athletic trainer here. So just to kind of give you my background on that, this is my first year as a certified athletic trainer. So I was fortunate that I found the job within baseball right off the bat. So I'm really excited to hear from all you guys and all your experiences as we move through the night here. But some of the topics we're going to cover tonight, talking about that career path into baseball, because again, a bunch of us are at different levels, different settings, so there's no one way you get into it. Talking about the life of a baseball AT, and at the end here, a lot of tips and tricks, because baseball's kind of a unique sport. Baseball athletes are kind of unique as well, so we'll kind of discuss a little bit of everything tonight. And that's kind of what I wanted to open up with, was some of the unique aspects of it. Because especially some of you who cover other sports, whether it be football, soccer, I guess I want to ask you, what are some of the more unique aspects that stand out to you guys, especially those who have the experience working different sports? So if anyone wants to open up with that.
Okay, go ahead, Stephen. Go ahead.
I was just going to say, having spent a lot of time at the Division II level, I've worked with a lot of different sports. I think the biggest thing with baseball to me is just the multitude of personalities that you have within one team and egos. And it's just it's interesting to see how all of those personalities, egos kind of mesh to all work towards a common goal. So I think that's probably one of the most unique things to me about working with baseball athletes, is just the variety of personalities that you get to deal with.
Absolutely.
Yeah, I really like that. It's funny, like you think of all the things that you like are close to you, and then somebody says something like that, and you're like, yeah, that kind of hits home too. I think for me, I think you have to want to, like, the people that work in baseball and do it for a long time, and obviously I've done it for a long time. This is my 13th year, 14th year at Notre Dame. Like, you have to want to be out there for 3 hours before a game even starts. You really have to want to do that to enjoy what you're doing at baseball. And like, people are like, oh my gosh, like the lacrosse athletic trainers of the world, when the clock hits 0, they're done. Like, and I say lacrosse, but it's any sport, soccer, volleyball, whatever, like basketball. And we might be there for 5 or 6 hours in a game because we go for, 17 or 18 innings. So I think you have to want to be there. And I say that also because for me, working with football, especially on a Saturday afternoon home game, I'm here at 7:00 for 8:00 practice, for fall practice. And then we might have a kickoff at 2 or 3:30 in the afternoon. And so it's a 12 to 14 hour day for me. But I enjoy it because I can flip a switch and go to another sport, and so, but it's unique to baseball to be there for 5 or 6 hours and enjoy it. So.
Right. Absolutely.
Kind of building off of what Steve said, like, just so many different personalities. I think baseball has way more like specialties. You have a pitcher, a reliever, a closer, someone who's a pinch runner or a pinch hitter that are all good at these specific things. You have to kind of take that as it is. Like, if someone is a pinch runner and they strain their hamstring, obviously their role in the team is either completely cut out or significantly diminished. And I just think that's pretty unique to where not a lot of other sports are going to have that.
Right.
I would agree. I think the thing that it kind of took me a while to figure out and understand was how, what's the word I'm thinking of? Like, they have like their set programs and their set like ways of doing things and they're so superstitious, and picking up on their superstition and running with it. I mean, like injury wise, like you could take someone's ankle and they hit a home run that game. Now you have to tape their ankle every single day for the rest of the year, even though, you know, they might not need it anymore, but they think, oh, I hit a home run with my ankle taped, I got to keep doing it. And just learning like the strategy side of it. It's just crazy. People who don't know baseball that well don't realize like the strategy of baseball. And like once you do, you're like, oh my God, I'm so invested. Like I could watch this 4-hour game and not get bored. But if you don't understand the strategy side of it, it's like, oh, another inning, here we go. But the biggest thing was like that superstition to me, and just figuring out like what each one's superstition is and using it towards your advantage.
Absolutely.
Yeah.
So I guess I kind of wanted to dig a little deeper into that, because that was actually one of my next questions, is about working with the baseball athlete versus working with the football player, the lacrosse player, and as Allison said, navigating some of those attitudes. Because as I'm sure you guys have run into, we have a lot of superstitions. We have a guy who, you know, they do their pregame stretch before they go out on the mound. If they pitch well, they'll keep coming back to you. If not, they might try to change it up. We're at a place where we have 2 athletic trainers for our baseball team, so that's definitely happened this fall. So I guess I want to kind of open it up to you guys and talk about how you navigate those personalities a little bit. I know that it's hard to kind of contextualize that, but for me, I think one of the first things that I realized was kind of the difference between hitters and those pitchers, right? Pitchers tend to be a little more careful, a little more habitual. And that was something that was new to me, because while I had some baseball experience as a student, being in it full time is really kind of eye-opening for me, and trying to pick up on some of those nuances myself.
Yeah.
Yes.
Oh, go ahead, Scott.
Well,
ahead,
what I was
Scott.
gonna say is like I learned kind of early on, like, and I think for most of us, like, we don't really take that kind of stuff personal if they don't want to come back to us and get a stretch and that kind of stuff. I'll always ask the guy, like, hey, do you want to stretch again? And most of the time it's just a quick pass off, like, no, I'm good, and you kind of let it go and whatever. But I think in those terms, like, just being flexible and adaptable. You know, a guy might come to you one week and then you might not see him for 2 or 3 weeks, and he wants to get the same stretch that he had 2 or 3 weeks ago. So just being flexible and adaptable in those situations, and dealing, like Allison was saying, like dealing with the different personalities and the different superstitions. And guys, I know a guy that likes to have certain kind of tape on his wrist, and it serves no purpose other than decoration, I like to say. But he likes it a certain way, and hey, if you're 3 for 4 that day, no problem. I'll do it all day.
Yeah, we like to call that eye wash in our league.
Yes.
Yes.
Yeah.
Very much. I think it's funny when you talk about it, because the superstitions almost play to their personalities if you kind of pay attention to them too. Like I'm thinking back to being at Lenore Ryan. I had our Friday night guy. He was a little quirky at times, and he just had this routine that it had to be at 11 o'clock every day. He was coming in and he was going to do moist hot pack, and then he was going to do these exercises, and then he was going to disappear and he was going to come back. But that's what he did, because he did it one time, and he threw 7 innings of like 1-run baseball, and that's just what it became. So it's kind of funny how I've noticed with personalities, just the way he is off the field and with other things, how they kind of match those superstitions to their personality. So part of me feels like you get to know them, you get to know those superstitions. And like Scott said, I don't think anyone takes it personal with it's, hey, I'm getting stretched this game, and maybe not this one. Like, I kind of pay attention. I always like to kind of keep notes of who likes what and pay attention to, oh, all of a sudden, you know, they had a bad outing. Now we're not doing this.
Right. Have you guys have any kind of a little bit off topic from that, but have you guys ever had any super weird things? I know like we have a guy who he has the same meal every time he goes out to pitch. Usually 3 Chick-fil-A sandwiches and 2 cookies. I don't know how you can go and pitch with that, but he does it. So
I mean, I know I had one kid, not quite that odd, but one kid. So it had to be before batting practice, but after batting practice, but before IO. He had to get both wrists taped, and then a double fist bump. Otherwise, he'd be searching for me, and he wouldn't be able to like concentrate on anything else until that happened. Because one game we did that, and he went like 4 for 4. So,
right, awesome. So I guess let's diving a little bit more. We've talked about navigating some of the personalities a little bit. Let's talk about a little bit more of the challenges, I guess, of working in baseball. I think Scott kind of alluded to it a bit, talking about, you know, when you're at a baseball game, you're there for essentially 6-7 hours, right? And I guess I just kind of want to walk into talk about some of the more tough aspects, especially since you guys, and Scott in particular, have had a lot of experience with baseball. So what are some of the tough obstacles that you run into as a baseball athletic trainer, and kind of how have you kind of worked to resolve those or work through those yourselves?
I mean, so with professional baseball, one of the biggest challenges, and it took me the whole first year to figure out and understand, was with my players, they get paid, so they have to play. Now, and the coaches want them to play, the players want to play. So trying to, if there is an injury, one, getting them back as soon as possible, or even having them play while you're still trying to fix the injury and get them healed. It took me forever to try to find that happy medium. Because when I was working at D1, it's like, oh, well, you don't have your next game isn't until like the weekend. So we have all week to get you ready. Whereas with our league, we play every single day. And if they have to miss 2 days, well, that's 2 games, possibly 3 if we have a doubleheader. So that was one of my biggest challenges, was trying to find that happy medium of, okay, are they capable of playing, or can they be held out, and then trying to work with them mentally and physically on getting them back to the game.
Right. So I guess I kind of want to go further with that one, and Steven, especially someone who's bang at both D1 and D2. I guess I want to ask you if you've noticed a difference there, kind of the changes you've seen between that D1 and D2, and if there have been challenges with that or kind of unique aspects making that transition.
I think the biggest thing that I've noticed is, one, the sheer volume of people I have to deal with. There's a roster limit at D1, so that helps. Otherwise, I had 65 kids at Division II. But in terms of challenges, I think the biggest thing that's been an adjustment for me is moving up, just having a few more modalities and toys, for lack of a better term, you know, when you're talking about multiple Mark Pros or Compex units or different things like that, and guys that are pretty set in their routines and their ways, and kind of stepping in and having to learn what they're about, how the program is done, what these guys are looking for and what they're expecting, because now I have the time to devote 100% of my day to them and to baseball. So I think probably the biggest challenge in that step has just been understanding the different things that I actually have the time to do and working individually. I've spent a lot of time one-on-one with our pitchers, you know, sitting down, hey, what do you do before you throw? What do you do after you throw? where are your problem areas? You know, right away when you're done pitching, where are you having problems the next day? So I think just the challenge of sitting there and being able to do that and stay focused on that and kind of have that understanding that a lot of these kids, and this isn't taking anything away from the guys I worked with at the Division II level, because I worked with some great athletes and great kids at that level, but they're a little more motivated. They want to do these things. And again, that's just the step up and a little higher level athlete from the mental side as much as the physical side. So I think it's just been a bit of a challenge to kind of step into that role and get that understanding of each and every individual and work with them to try to find that happy medium in ways that I can help them with what they're already doing that's working for them. So it's kind of been more that than anything right now, because I haven't got into a season at the Division I level. So I'm sure there's going to be a different answer to that if you ask me in 4 months.
Right.
And, you know, I was going to say, as you were talking there, Stephen, like, I think it's interesting when you say that, to have time to sit down, because I think, Nick, you're going to hodgepodge of different sports at the Division III level. And I went to school at a Division III school, so I get that, you know, you have one athletic trainer that may cover 2 or 3 teams. And I think the difference there is we have the time. You know, I have baseball, football, but there are 4 other people that cover football. So I don't have to dedicate time to football practice, and I can dedicate my time to baseball and sit down with those guys, or sit down in the off season when we finish fall ball and go over what worked for you, what didn't. I kind of do that with our freshmen when they get here, but then the other guys, it's like, okay, what worked for you and what didn't? So I think that would be a huge difference. I think that's something probably, and Nick, I don't know your situation, but I feel like that if you're dealing with a lot of sports, you probably don't have a whole lot of time to sit down with 30 guys or 40 guys or whatever it might be.
So the nice thing for me is with in the spring, normally, not this spring as we discussed earlier, but normal spring, we really only have 3-4 sports going on. So a lot of the time I'll be splitting time with baseball with Rick, our head athletic trainer. So I'll, make the trip to Florida with the guys for spring training, do those 10 days of them, and then come back, and we'll kind of split up games so that no one is really overworked and burnt out by the end of it. So sometimes the guys will come to me for rehab. Sometimes they'll come to Rick. So much like you guys, I have that time to really split up and get that one-on-one time and activity. So it's actually really nice where I can get that sports specific stuff with them.
So one thing I was going to – oh, go ahead, Stephen.
I was just going to say that's one thing that I've really enjoyed in the transition is like having that time to sit down and do it and specifically make it for that athlete. Whereas when I was at the Division II, working football and baseball, I've got 200 athletes between those sports. And it's like, I don't have time to generalize a rehab, individualize a rehab. It's more of a generalized rehab that you're going to get. So yeah, I've really enjoyed that, and it's been a different challenge, but it's a good challenge.
One other challenge I was going to talk about was, and I'm curious because I want to get Obi's take on this too, because I think you have, and Austin too, but there's 4 of us on here that work in the North. And I think from a travel perspective, obviously D3, quite a bit different travel situation than the D1 schools. Professional baseball different than college in some respects. Like, I think one challenge I know that we deal with, and I'm sure Stephen's going to experience it a little bit here come up in a couple months, is, we're on the road for the first 5 or 6 weeks of the season. And it's leave on Wednesday or Thursday and get home Sunday night late and turn around and do it 3 days later for the first 5 weeks. And then when we get home in the middle of March, it might be 35 or 40 degrees. We have turf, so we can play when it's cold and maybe a little bit of snow, just brush it off. But then we're going like Monday, or we're going Tuesday, Wednesday, Friday, Saturday, Sunday at home, 5 days out of the 7. So I think that's a challenge for northern schools versus the southern schools. I'm curious to get Obi's take on it, because I'm sure you guys are home for a bunch and then travel, or you kind of mix it up. Austin, same way, and I'm sure Allison in the spring when it gets cold is probably in the same situation. Nick and Steven, I know, hasn't experienced it yet, but he's a little bit further north than I am. So
Yeah, no, I think we're pretty fortunate where we are temperature wise. We had a couple schools come to us, and listening to their travel schedule just made me realize how fortunate we were in that regard. So we had a couple schools come from us from up north, and then we stayed pretty local for the most part. We have Texas A&M, UT, LSU are all pretty close. So originally we had before COVID, I think we had planned to probably go back to LSU. We played at Tulane right before everything got shut down. So travel wise is pretty good for us. I would say just specifically where Beaumont is, we do have we had 2 pretty major hurricanes hit back to back. So that was probably the one thing that really pushed us back in fall. But other than that, like I said, mostly sunny for us here. So.
Right. And for me, so I went to school up in the north, up in Wisconsin. So I got to experience some of the wonders of spring baseball there. So it's definitely been kind of a nice change. I'm at a big enough school that we don't do a whole lot of travel, but I do kind of understand where you're coming from, just from having a little glimpse of what that spring is in the north. I know that when I was doing my school, I think we had a 2 out of a 3-game series. It was wasn't snowed out, it was cold out. We had to cancel, couldn't reach the temp. So I know that that's definitely experiencing. So that was one I tried to forget a little bit.
Yeah, we get that too. Our field is directly on the Boston Harbor. So, and it's right by the airport, so it's cold, it's windy, it's miserable, not enough layers ever.
Right. All right. So I guess I want to kind of talk a little bit now about baseball athletic training and kind of some of the big takeaways we can take from working in baseball that you can take to other sports. So Scott working with football, Nick covering your couple sports. What are some of the bigger things that you've learned from baseball that you can apply to yourself as a general practitioner and clinician? I just kind of want to get your guys' viewpoints on that, kind of what you've learned. So I know you all have had a bunch of experience so far.
So I think one thing for me is in the fall, I have women's volleyball. So that, repetitive overhead motion, it's very, very similar in like the injuries that I'll see in the rehabs and the throwing motion. So a lot of that will cross over back and forth. I think baseball specific is going back to those personalities. Different people like to do things different ways. And that really kind of opened my eyes of like, not all these athletes, this one athlete's not going to benefit as much from this certain exercise or this certain treatment as this other one might. And really just trying to adapt. And everybody likes to do their own thing. And one thing may work for someone where it may not work for someone else.
Right.
Yeah, I think going along with that, we're talking about personalities and what works and what doesn't. And one thing that I've helping with football, one of our kickers for football actually gets his plant leg ankle taped for practices and games, and that's just his thing and whatever. But it's very much a Scott needs to tape me on game day type of thing. and he has a little pad that he puts on his foot too. But it's very much it's a superstition thing, but I think it gives him a little bit of confidence too. And so that's one thing that I think I've kind of carried over into football. And in the reverse side of it, like one of my roles, depending on the game, is myself and another athletic trainer act as our medical observer. This year is different since we're in conference, but typically when we're independent, we're kind of our own medical observers. So we're up in the booth, and I'll be honest, like I think it's made me better on the baseball field, in practice and in games, just being more aware of things on the field. And then I've kind of transitioned it back over to baseball, just being more aware. So I think we could do that in baseball too, right? You're more aware, you're paying attention to every pitch, what that pitch was, or what the specific pitch was that an injury occurred in a shoulder or elbow or whatever it might be. So just being more aware of those things in your surroundings and those sorts of things to kind of big picture type things to take into other sports or other settings.
Yeah, I would agree. I'd to kind of piggyback off what Nick said, like the different personalities. Baseball players remind me, I've worked with track and field as a GA. Baseball players kind of remind me of track and field athletes. They're hyper aware of their bodies. Track and field a little more in their legs. Obviously, pitchers in baseball with their arm, their shoulder, if something doesn't feel right, they let you know. But that personality and the differences and sitting down and talking and understanding and learning kind of different ways that each one of them deal with things has helped me carry things into other sports. And like Scott said, I worked men's soccer a little bit at the Division II level too. And there's so much going on there that you just have to be aware and ready and watching at all times. So I think both of those points that Nick and Scott just made were great on things that we can use as baseball ATs, and we can take from other sports to help us on the baseball field.
I think for me, coming from football where, you have so many tools to use, you have all sorts of shoulder harnesses, the braces, all these things that you don't really use in baseball. And then from what I've experienced, programs that you create, whether it's mobility or strengthening, that are, you don't really see as, it's not like you're lifting, 50-pound dumbbells to strengthen. It's you're strengthening such small muscles that do so much. You really see like the positive effects of that, where a lot of times in football, you really just have to get your linemen through the next game. They come in Sunday, you do some feel good, you know what I mean? It's a very different process, but being able to see these small changes that you can make in someone's mechanics or, even core strength or single leg, strength and stability, how big of a difference it can make is just something that I think isn't utilized as much in sports like football or soccer, but definitely have a place there.
Right.
Yeah, I agree. I see that. I mean, I see that every Sunday. It's like, get them back, get them refreshed on Sunday because, Monday they're in film and Tuesday we're back at it, versus we come off a weekend and you get back Sunday night. For us, we get back Sunday night late and we've got a midweek game at 4 or 5 o'clock on Tuesday. I tell my guys all the time, like, Monday is, listen, it's your off day, but I want you in the training room as much as you need to be ready to go on Tuesday. And so, like, Monday is my day to, like, get them better, I guess, or get them game ready, I guess is a better way to put it. And I agree. Like, I don't think some other sports have that rush mentality sometimes.
Right. All right. So we've talked about a lot of the unique aspects, talking about the personality, the game schedule, the demand of it. So what I want to ask you guys now is, give us a piece of advice. What's one thing, we're going for kind of baseball hacks here. What's a must-have, a must-know, kind of a hack to baseball life to make it a little bit easier for yourself?
Bring food with you.
Yeah, I was gonna say pack snacks.
Yeah.
Mm-hmm.
Seeds, trail mix, protein bars, whatever you want, but bring food.
Yeah.
Yeah,
Because you're gonna be hungry, and they're gonna ask you for food.
Yeah.
Yes. So one thing, and I'll freely say this, and like one thing that my guys give me a hard time about is I get our managers when they make the little snack run, or we'll have the PB&Js and stuff in the dugout and whatnot. I was like, hey, grab me a couple Cokes, Coca-Colas when you go to the store. And it's now a thing. Like that's my thing on game days to have. And the guys just bust my chops about it. But I'm like, guys, like listen, this is what gets me through the game. I'm just going to be as superstitious as you. Like, this is what gets me through the game. If I get a Coke and if I haven't opened it yet and we've got a shutout going, I'm not touching it. Like, so that's one thing for me. One thing I wouldn't be at Notre Dame if I didn't network when I was a grad assistant. When I was a grad assistant, I was at Villanova. We were in the Big East, and we came out here twice in my 2 years. We came out here back-to-back years, actually, and I met the baseball guy who happened to be also football. And, 3 or 4 years, or I guess 2 years later, after the second year, he's taking baseball off his plate and going strictly football. And the baseball job opens, they create a position, it's just baseball. And that was my way of reaching out, and I'm interested, and here we go. And 14 years later, I'm still here. So for me, it's networking, introducing yourself to the other athletic trainer before the game, even if you know each other. They may know somebody or have somebody in the dugout that you might want to meet, or they may want to meet somebody on your team, your staff. So that's my thing is networking, introducing yourself, and building a network of, and Obi can relate to this. I think Austin can too. Like we have the college baseball athletic trainers, group message, email, chain, all of that stuff I think is based off of networking and being a part of that group. I think we're an interesting group. We're kind of like the baseball guys in pro baseball, the P-Bats, like they're kind of their own group. And they kind of hang out together and they run together. And so that's, for me, it's the networking piece and building those relationships.
Yeah, I would agree. And that's funny that you say that about the Cokes, because I always have a different candy bar every game. So I'd get stick about, what candy bar Steven got today. And if we won and we were winning, it was the same candy bar every time. Yeah. But I think one of the things that I would say is just try to be a sponge and learn as much from everyone that's around, has been in baseball, because there's no clear-cut way to do it one way or the other. Whenever you look at anything about the shoulder, there's no 100% definitive. You can learn something from everyone. I don't think there's one clear way to do it. Everyone does it a little different, and everyone has had success. Otherwise we probably wouldn't be where we are. So I think just be a sponge, and be willing to learn different techniques, ideologies, methodologies from other people as you go along.
That includes coaches, I think, too. Like there's a reason why they're the head coach, the assistant coach, the pitching coach. Like they will absolutely know more than you in some aspect of the game. So ask them questions just as much as other athletic trainers.
For sure.
I would agree.
I would have to say the same, especially being a little bit newer to baseball and, just not football. I don't want to say it's easy to understand, but I feel like there's just so much more to baseball as far as how the game is played. I ask questions. I talk to the guys a lot, and just like, if I don't understand something or if I want to know more, like I've pushed myself to ask questions, just because, sometimes you just need to know those things in order to help somebody get better. Same, especially our pitching coach, he's great, and we've worked really well together. But there are certain things that he's going to know that I just don't. And I think, collaborating with your coaching staff is going to be, is only going to help you in the long run.
I would agree. I've learned a lot from just my players, asking them questions of what they what they do, what they used to do, what they've seen in other programs that they were in. But then another thing is just accepting if you don't know an answer and saying I don't know, but I will look it up and get back to you, or I'll ask someone else and get back to you. I think a lot of times we're afraid to admit that we might not know something. So we make something up, and then we lose trust in our athletes because every athlete goes on WebMD and looks their diagnosis up. And then they're like, well, you were wrong. So I think just being willing to accept that, yeah, I might not know the answer, but I'll get back to you. But yeah, and then even just reaching out to strength and conditioning coaches, PTs, doctors, team physicians, and just collaborating with everyone so you are constantly learning and growing in your profession.
Yeah, I think for me, I mean, I've been lucky. We've had a couple coaching changes since I've been here. But I've been lucky to have the same pitching coach now for 11 years. And he was the one holdover in the last coaching change we had. And I think the biggest thing is him and I, like, we talk about each guy as much as we can, and what is working for them, what's not. They have a lot of trust in him and I to know that we're not going to steer them wrong or do any of that. And I think what Allison said, like strength coaches, and my strength coach has been our strength coach now for 3 years, and she's awesome. And she's great with the guys, and she's a little bit, it's interesting. Like guys are like when we travel, it's like, oh, you have a female strength coach. Like some people don't realize that, like, she's pretty good at what she does. And she actually lifts like Olympic lifts, like in competition. So she can outlift some of our guys. So our guys have a ton of respect for her in what she's explaining to them. And I've learned a ton from her in just what her program is and how different it was from the previous person we had. But what is working for us. And so I think that's all great points. Be collaborative, be a sponge, listen, talk. I probably, sometimes I feel like I could coach, my own team sometimes. I don't know. I don't know how you guys feel, but no, I think those are all important things that are good for baseball athletic trainers to, people just getting into baseball to know. I think it's great, Obi, that you're doing that and working together with your pitching coach. I think that'll carry you a long way.
Yeah. And I think that point of the relationship with the strength coach is huge, because you can knock out so many things there if you're both on the same page, and you can utilize that to your advantage. I think it's a little bit of times underutilized what the strength coach can do for a program. I've been lucky where I've worked that the coaches that I've worked with are big in the weight room and having them in there, and I've seen benefits from it compared to other people that I know where they just don't do that much lifting and the problems that they've had.
Nick, I'd be curious, like at the D3 level, with obviously maybe not having as an extensive strength staff as some D1 schools, how do you guys handle that particular aspect of it?
So Rick, our head athletic trainer, is also our head strength coach. So there's 3 of us at Suffolk. So we all are constantly working closely together. So it's 3 athletic trainers who's also the head strength coach. So it's very easy to be collaborative and know what's going on in the weight room, know where people are having deficiencies or weaknesses or imbalances, and really adapt those treatments and rehabs and practices so that everything in the weight room, game day, practices, treatments, it's all cohesive and kind of working together to, optimize performance.
That's great.
Yeah, that's good to hear. I'm kind of curious to hear from Allison kind of on the same thing with the independent league being how that situation kind of works.
As in in what way?
Just in terms of the relationship with strength, because I don't know a ton about the independent league, but I know, I think of minor league baseball, and a lot of that is AT strength coach. So I was kind of curious what the dynamic is there.
Yeah. So actually, the team I'm with, this is our going on our third year. So the first year we didn't have a strength and conditioning coach. So it was all on me to have to develop like a program, a lifting program, a maintenance program, a fitness program. But this past year we ended up getting a strength and conditioning coach, and him and I would collaborate probably daily on how everyone's doing. So he would create individualized workout plans for each athlete, depending on their position, their level, and what their goals are. And then also he would talk to me and be like, hey, are there any injuries that we need to work, like strength things we need to work on? Are there any restrictions that they have? And whatever I see at the games, I would relate to him, and we would kind of bounce ideas and treatments and rehab protocols off of each other, which is phenomenal. He would come to preseason and would just make sure, like, he would be at all the practices during preseason and teaching them right ways to stretch, right ways to, get their bodies ready for a game. And then we would just collaborate, I would say daily, and we'd even get the coaches involved and make sure everyone's on the same page.
That's awesome.
Yeah, that's great.
A lot of good advice here, and I know that I personally am fortunate. We have 2 strength coaches that we work with, and probably spend the most time with them out of any of the other staff members within the program. So kind of illustrating that importance of communication. Previously where I've been, their strength coach was their athletic trainer before he made that transition. So when you have relationships like that, where you understand kind of where both of you are coming from, it makes things a whole lot easier for everyone. So definitely a lot of good advice. Thank you all for that. Now kind of what I want to do is I want to move into our AT Chat 5 questions. So these are kind of the questions that we ask everyone at the end of the episode, except we've kind of thrown a curveball in here a little bit, and we've modified them a little bit for baseball. So I think I'll start with from the top left corner of my screen. So I'll start with Nick, and I'll have you guys go around and answer these individually. First question, where do you see athletic training going in the next 5 to 10 years? So kind of set that example. And you can address that as a profession as a whole or in the baseball setting.
I think kind of actually going back to what we were just talking about, more and more strength and conditioning is going to be involved. I think it's a largely underutilized aspect of the athletic sports medicine type world is utilizing those strength and conditioning coaches because, between hitting, pitching, throwing, all that, it's coming from the hips, it's coming from the core, not just the rotator cuff. And a lot of the time, those strength and conditioning coaches are going to be able to focus more on those sport-specific movements and large body movements, whereas we'll focus on, the rotator cuff strains and the lat strains or whatever the case may be. So I just think it's going to mesh a lot more with strength conditioning. Strength and conditioning will be like in the dugout more so, and those two different career paths are just going to sort of intertwine a little bit more as we go along.
Awesome. Scott?
Yeah, that's a great point, and I think that's going to be a huge piece, especially in baseball, but I think across the board in athletic training. But I think for me, this is going to expand into not just baseball. I think you're seeing it with some of the training modules with oh gosh, I'm drawing a blank now, but like the polar and I forget what motion thing we use for football here, drawing a blank, but the analytics of movement, of injury handling, like just breaking down the analytics of things and applying that to how we're handling injuries. Stan Conti is doing a great job of breaking down that stuff out on the West Coast, and starting to find trends in baseball injuries, whether that's soft tissue stuff or ulnar collateral ligament or shoulder. I think what you're going to see specifically in baseball, but I think you're already starting to see a transition of utilizing that data and applying it into rehab, applying it into the weight room. And so I think that's going to start to change how we view things, how we treat things, workloads, all that stuff is going to be an important piece to what we're doing.
Absolutely. Obi?
I mean, I definitely agree with Scott. I think specifically with baseball, I think in the next 5 to 10 years, I feel like baseball is almost like a specialty within athletic training. There's just so much that you really do have to consider, like I said, not to discredit any other sport, but just because of how, especially pitcher, how fine-tuned they have to be, again, from the ground up. It really takes, to me, a lot of knowledge, a lot of work to maintain someone that's, throwing 90 plus miles an hour and keeping them healthy. But technology, I think, is going to be huge. Biomechanics, we use the Motus sleeves. I think they have their place, and for me, they're not the end all be all, but I think that's just another tool that we're adding to the care of our athletes. And then the other thing too that I think is really underutilized is nutrition. I know not everyone is able to have a dietitian on their staff, but there's just so many things that you can do from a nutrition standpoint, I think, to help your performance, especially within baseball. I'm sure we all know those athletes that load up on NSAIDs, and there's just other options that you can use that are healthier for your body, but also maybe have some sort of anti-inflammatory component to it.
Right. Steven.
Yeah, I would agree. I mean, all three of those points have been great. And my thought was kind of along the same lines of what Scott said. We're going to get more into data and analytics and understanding different trends throughout the kinetic chain, I think, that are going to help us understand the shoulder even more, the shoulder, the elbow, whatever it may be, to kind of help understand how different areas, and we already have some of that, but I think some of this data that we're going to continue to get is going to help us see different trends outside of just looking at hip internal, external rotation. We might look more at ankle dorsiflexion, big toe flexion, different things like that is what I kind of see. And then the other thing that I've thought of a lot, and I know I've talked to our coaches about it, and they've kind of made it a priority within the program, and we have it within a survey that we do daily, is sleep. In a survey that we have our guys fill out daily, we ask them, how many hours of sleep did you get last night? Do you feel rested today? Just that recovery aspect that you get from sleep and the benefits that come with it. I think that's another area that athletic training, not just in baseball, but as a whole, is headed and looking more into.
Right. And Allison.
Yeah, I completely agree. I think we're going to move towards more looking at the physiological side and understanding how the parasympathetic and the sympathetic systems work and how they regulate and how that is going to lead to recovery. I think we'll start looking at that more and being like, okay, something's off in their physiological system, which is why they aren't recovering as quickly or why they're having all these injuries. And with technology, we're going to be able to do that a lot more. And then, yeah, also going with what everyone else was saying with, I think athletic trainers in general, I mean, we're slowly making progress in people understanding what we do, who we are, and how important we are. And I think over the next couple of years, we're going to get more respect and we're going to be able to do more within our profession that will help our athletes in the long run. But with all this technology that's coming out, there's going to be so much more room for us to continue to grow and to continue to help those athletes in the long term and the short term.
Awesome. So this question actually kind of piggybacks off a little bit of what we're talking about here. We'll start back at the top here with Nick. But what has been one resource that you found through your athletic training career that you found the most influential? And that, again, can be general athletic training, can relate to baseball, however you want to open it up.
I think my peers. Events like doing things like this, where talking to other athletic trainers, getting perspectives, other experiences, and just putting yourself out there as much as possible, so that you can, absorb as much information as possible and kind of apply it where and when necessary in your practice. I mean, try to absorb as much as possible from people that have been through it already, so that you don't make the same mistakes or whatever the case may be.
Right. Scott?
Yeah, just piggybacking off of that, for me, I was lucky enough that when I took the job here and when I took the job at the time, Notre Dame was a pretty successful program. And then they had a coaching change, a coach left, and we've been cruising along. But for me, it was I was lucky enough that the guy that I replaced was still here. And so talking about Nick and using your peers, like to have him here when I started to make that transition easier, they didn't have to they had to learn a new person, but the older guys still had him to kind of go to from time to time, and that was okay. And I actually embraced that as a young athletic trainer. But I tell you what, it helped me when we were on the road, and I'm, learning from him as he's taking care of these guys. So when we're on the road and I have to take care of those guys one-on-one, it was super easy. And it made that transition a lot easier. But I think for me, just having the support of the coaching staffs that I've had and my peers, but more my coaching staff, having the coaching staffs that I've had and been super supportive of myself and our sports medicine program in general and our team physicians, and to allow us to kind of do our jobs. Like Allison was saying, there's so much that we are exposed to and can do. And I think having that support, you build respect across your program. And as an athletic trainer, just in general, if you're the only athletic trainer at a high school, just open yourself up, be a sponge, do things, offer to do things. Those are the resources that you're doing something, but it's a resource that you can go back to and say, hey, look, I did this. I have experience in this, and it can help you go a long way. That's for me, it's having the support structure and having them allow you to do your job, and not put a whole ton of stress on you. It just makes life and work just a little bit more tolerable and easier on the tough days.
Absolutely. Obi.
Yeah, I mean, pretty similar to what Nick and Scott said. I think just really being able to rely on the network that I've built, because sports medicine is really just, again, about collaboration. You have different areas of medicine within one, all of them, there to take care of a student athlete. But I've learned from, strength coaches. Again, I've worked with some amazing dietitians, neuropsychs, hand and rest specialists, and just really taken something from everyone that I've kind of run into and used that in my clinical practice. And that's been extremely helpful for me, but I think my patients have also benefited from that.
Right. Steven?
Yeah, I mean, I would agree. Mentors, peers, they're there for a reason. You have them, utilize them, right? It's one thing that I take a lot of pride in, is being able to call some of my friends and, hey, I'm having some trouble here. What have you done with this in the past? So I think utilizing that, but just to give another answer, so it's not just the same one throughout. One person that I really like to read their articles or watch videos or have kind of reference to is Mike Reinold in baseball. He's a big name PT. He's got great content. It's a place that I've gone to learn a lot of things, or help myself understand some things that maybe I didn't have an answer to, or just get new, fresh ideas in my head. So Piers and Mike Reinold and what he does is great for baseball profession and the medicine world.
Yeah, awesome. And Allison.
Yeah, I agree with all of you on the peers and your mentors. But another thing is different experiences. I mean, if you get the opportunity to try a different sport, a different event, go with it and do it, because you learn new things in every different sport that you cover, and that you can carry on to baseball and any other sport you're working. And especially if you can get the chance to work odd sports that you've never worked before, like ultimate frisbee or bike races, or just something different, because you'll learn something new that you can incorporate into your own practice.
Awesome. All right, and this one is kind of a fun one here. If you could change or eliminate one thing, whether that's a modality, common practice, mindset, so on, in the field of athletic training, what would it be? We'll start up at the top with Nick here.
I think that there is, I'd take a risk with this answer, but there is no treatment or anything that you can never use. It's always, everything has its place, right? Ultrasound catches a lot of flack because people say it doesn't really do much. Ice is getting more and more pushback, but I think those things still have their place, whether it be in a specific case, a specific athlete that has used it before and has liked it in the past. I just don't think that we should completely discount anything at all times, because everything may have a use.
Right. Scott?
I like that answer a lot, actually. That was, this one's fresh in my head because I had to kind of elaborate on this with our team this year. And it was that the training room, the athletic training room, is not a bad place. And I think a lot of our athletes, especially now, specifically in baseball, but I think this crosses everything. This isn't just a baseball answer. But baseball, I think I see it more because I don't think our baseball players at this age, in the college setting, in the younger college setting, like truly understand that the guys that play at the major league level, and Allison can probably understand and can probably echo this a little bit, like at the professional level, they're not just avoiding the training room. Like they're in there every day to take care of their bodies, to get treatment, whatever. And so for me, it was telling our guys, and this is something I just push out, like, this is not a bad place. Like, I want you to come in and treat a sore ankle with any modality that, that we can use, like Nick said, to get you to feel better for 2 days. I'd rather you come in for treatment in 2 days than to miss a week and a half because you didn't take care of yourself. And so for me, it's getting that mindset of the training room's a bad place. If you go there, you're not going to play. You're going to be on the injury report. Yeah, you're on the injury report because coach wants to know who's getting treatment, but he knows that so-and-so is getting treatment, but they're practicing completely fine. He just wants to know that. That's just how our coach is. But I think it's been great to do that, and I try to encourage that with our guys. So that's mine.
Right. It's a really good point. Obi?
Yeah, I like that Scott said that. I don't, and being a part of so many recruiting visits, every time they bring, the kid and their family by the ATR, it's always like, well, this is a great facility. We have these things, but, you don't want to be in here. It's always like, that's always like the line that they say. And it's just kind of funny that you said that. So But yeah, definitely true. And I think, just to kind of add on to what Scott said, you're ultimately you are there to get better. Part of our job is, to prevent, is preventative. So if you're in there to get better, that shouldn't be seen as a negative. But as far as what I could change, I think, just kind of going a different route. I think, as far as our profession, there's still, I think, a lot of people just don't really see eye to eye. I know whenever we made the degree change, I feel like a lot of people were divided, and, we don't really, you have strength in numbers. And if, we're not kind of all on the same page as a profession, whether that's from the education standpoint or the practice standpoint, I think that's, that's not helping us as a profession. So if we could all just kind of, I don't want to say get along, but really, just get along and with the goal of elevating the profession.
Absolutely. Stephen?
Yeah, I think every single one of these has been good points. And this one is kind of something that I've always thought, just because, like I said, my time at the Division II level and trying to push into the Division I baseball level, which has always been my goal, was the mindset that, hey, if you don't have Division I experience, you can't work at a Division I school. Or if you don't have collegiate experience and you're just at a high school, you can't come step into the collegiate setting. I think that mindset is changing with the younger generation, my generation, the generation below of athletic trainers coming through. But there's still some of that mindset with some of the older generations that, hey, you've never worked at this level, you can't work at this level. Well, I've been at both levels. It's so far from my experience, athletic training is the same at Division I as it is at Division II. I did high school rotations when I was a student. It was the same job when I was a student working in a high school as it is working at a Division I university. So I think kind of that stigma of, hey, you don't have Division I experience, college experience, professional experience, you can't work at this level. I think that just isn't a great thing that we have in our profession. And I think it's just something that needs to change.
Right on. Allison?
Yeah, I was gonna say basically what everyone else was saying was, like, the athletic training room is not a scary place. It's almost like a safe haven if you think about it. And just because you're in there doesn't mean you're hurt. You could just be coming in there because you need maintenance work done, and then you're trying to keep your body healthy instead of, oh, I was told I can't go in here, so I'm only going to go come in here when I'm actually really hurting, instead of being like, oh, I'm kind of feeling like this, a little bit of pain, I'm going to go in there and just, control it now, kind of thing. But yeah, and then just the other thing is just keep advocating for our profession and showing people what we can do, what we're capable of doing, and getting everyone to, like, buy into us. Because I know a lot of times people are like, oh, well, you're not a doctor, so I don't really need to listen to you, because they really don't know what education we all have to go through and how much we actually know.
Right. All right. Final two here. Back to the topic. Nick, go back to right when you graduate, right when you're coming out of school. What advice would you give to yourself as a young athletic trainer?
Never stop asking questions to anybody. Learn as much as you can about anything. There really is no such thing as a stupid question. If you're thinking about it, chances are somebody else is. So never stop asking questions, regardless of the topic. Inside athletic training, outside athletic training. Most of the time, you can apply answers to multiple things.
Right. Scott?
Yep. I mean, I had that down, but I do have another answer. So mine was be a sponge, but I mean, it's the same thing. Ask questions and do those things. But mine also, and Allison alluded to it a little bit earlier, is, and I think we're finding out, especially in the COVID era, of so many questions about this and that and everything else, is it's okay to not know an answer and to go look it up, or, like Nick said, go ask a question, go ask someone else. And I think for me, as a young GA, I went from a D3 school. Steve was talking about it like I was a D3 student, and then I'm in the D1 level, and it was like, okay, here you go. This is your team. You're a GA. So for me, it was I tried to know everything, but I know I didn't know everything, so it's okay to not know.
Right. Absolutely. Obi, what advice do you have for us?
I would just say for me specifically would be to not second guess yourself so much. I think being a new grad, you are scared to ask questions and you don't want to be wrong. And, there are times when you do 100% know what you're doing and, what you should do. But it's always definitely a confidence thing. So I'd just say trust yourself and not second guess as much.
Right. And that's a good piece of advice for sure. I can tell you as my first year here, run into that a couple of times, but so definitely a good reminder for sure. Steven?
Yeah, all three of those were on my list, but the other one that I think if I could go back and look at myself and tell myself is work doesn't have to consume your life. I've gotten better at it. I'm still not great, but I know for most of my career, my job has consumed my life, mostly because I let it. There's been days where I've just gone into the office to do something that I really didn't need to go do on a weekend because I just didn't know what else to do and I wanted to get it done. So that would be my advice is work doesn't have to consume your life. Have a life outside of your job.
I think that's some really good advice, especially for us who are baseball athletic trainers running with that 60-game schedule, 50, 60, whatever it might be. That's definitely a good point there. And Allison?
I would say never lose the desire and the urge to want to keep learning. With our profession, it's constantly growing, constantly changing. We're constantly learning new things and developing new things. So allow yourself to, get yourself to want to continue to learn all those things, but also if something new comes out, allow yourself to be like, okay, what I used to do probably isn't as beneficial as this new thing. So I'm willing to change my practice and what I normally do because of this new research that has come out.
Right. All right. Last question for you all tonight. Starting up with Nick, this is the big one, is what does being an athletic trainer mean to you?
So I thought a lot about this question actually. And what I came down with was what I tell my athletes at every, beginning of the year team meeting. In my eyes, we're an advocate for them. We're supposed to help them in any way that we can, whether it be through a tough time that they're having with school, and that could be pointing them in the right direction of if they need to go see a mental health specialist, if they need to get a tutor, if they just need someone to talk to. If they're injured, advocate for them to the coach, to other strength and conditioning professionals. Just help them, be there for them, advocate for them in any way that you can.
Absolutely. Scott?
I like that. I think one thing for me, I'm going to have a two-part answer because I think all the answers that I've heard tonight with everything, I've realized that, and I hope everybody else does too, like sometimes I feel like I'm the only one thinking in those like directions, but to hear Nick's answers and Obi's and Steven's, like to know that other people are on the same track as me, and colleagues, peers in baseball that are on the same track, Allison the same way, like it makes me feel comfortable and to know that you're not alone. So I think as an athletic trainer, I think that's part of it. But for me, it's being a part of something greater than yourself. You're a small part of the team to build or teams that you're working with. And you're a huge part. We're all a huge part of those teams that we work with. But the goal is successful team, healthy team, successful athletic program, whatever it might be. And you can share in the celebrations, and you can comfort everybody in the down times and the bad times. But you're a small part of something that's way bigger than yourself.
Right on. Obi?
I would say being an athletic trainer is being able to build relationships with people. I know, sometimes I don't know if it's, schooling or, preceptors, however, whatever it is, there's definitely a line that needs to be drawn from a professional and a personal standpoint. And I totally, totally agree with that. But I think some people are kind of just are a little bit more to one side where they're just really professional and, I don't talk about my family and kids or, whatever it is. And I think that doesn't necessarily help. I think whenever we really get to know our patients, that helps them. You know what I mean? I think in my experience, what I've seen is, I've had guys come in for their daily rehab or treatment, and they're just not the same for whatever reason. They're just not, there's something there. And it's like, if I didn't ask how daily questions just about their lives, I wouldn't know that they had 3 exams that day, their girlfriend broke up with them, and, their family, lost their dog or something like that. And all those contribute to, to their health. And I think it's okay to get to know your patients on more than just being an athlete.
Awesome. Stephen?
Yeah, and I love these answers I've heard. This is one of the things I love about the profession is the people that are in it are amazing people. All of you guys are too with these answers. But to me, it means, like Obi said, building those relationships and being that at times that person that somebody can go to when they're away from family, away from friends. That kind of beacon of hope at times, we see them when they're at their lowest, whether that be an injury or they're struggling, moving away from family, from friends, being away from home, and having that reputation and building that relationship where they know they can come to you no matter what the moment may be, and you're there for them. And sustaining those relationships down the road. I still hear from former athletes that I've worked with all the time about things. Hey, I got a question on this, because you've built that reputation that, hey, you're there for them, you care about them. So to me, it's just building those lifelong relationships and being that person that they can come to and helping them through their lowest of lows and watching them achieve their highest of highs at times.
Right. And Allison, last one here.
Yeah, I completely agree with everything you guys have said. I mean, to me, it's kind of like we tell like our students and new athletic trainers, the athlete is more than just an injury. They're a person, and we have to think about it as us too. We're more than just athletic trainers. We could be their mentors, their saving graces, someone that they can come talk to. Sometimes even become part of their family, because like you said, a lot of them are going across the country or even different countries to go play. So they may be all alone. So you become their support system. And I think once people as athletic trainers, we realize how much more important we are and how needed we are.
Right. Absolutely. A lot of good advice from all of you. I do want to thank you all again for sharing your time and your experiences here. So that kind of wraps up all the questions we have for you. I just want to make a last call here, see if anyone has anything they wanted to share. If not, if people want to reach out to you, what would be the best way to do that? So if you have a Twitter handle, Instagram, email, we can link all that stuff up in our episode sheet. But again, if anyone has any last words of advice, or else we'll kind of wrap it up here. Again, thank you guys for all your time. Hopefully we can do this again soon, especially after Bound to be a odd season for all of us, right?
Yeah,
Sure.
yes, and that's what I was going to say is I think with everything going on, I think credit to all of the athletic trainers out there working in collegiate or professional sports that are dealing with COVID on a daily basis, testing, contact tracing, whatever it is. Just shout out to all of us and give yourselves a pat on the back, give yourselves a little bit of praise and for working hard in something that I know my boss told me. He said this in a staff meeting, I don't even know how many weeks ago. Like, the bottom line is none of us signed up to work in medicine during a pandemic when we got into it. And I think, we're learning a lot more about ourselves as professionals and as people working in medicine. So shout out to everybody for working hard and putting in long, crazy hours dealing with something that we didn't really sign up for to start with.
Absolutely. Again, thank all of you for your time tonight. It was a good time. I enjoyed hearing from all of you. And best of luck for the rest of your seasons here.
Thanks. Good luck, guys.
Thanks.